Hi, everyone. Welcome. I'm Linda Way, she, her pronouns, Associate Director of Policy Advocacy, and excited to share our legislative agenda for the year. And I'll pass it over to Brandon.
Good afternoon, everyone. Brandon Green, he, him, his. I am the Director of Policy Advocacy here at the Western Center on Law and Poverty. We thank you for taking a moment to join us and hear a little bit about what we will be doing this year in the policy realm, which is particularly important this year as we are in precarious political times and precarious budgetary times. And so all of this advocacy is needed more than ever. And with that, I will pass it to my colleague, Sandra, to begin talking about some of the legislative vehicles that we'll be working on this year.
Thank you, Brandon, and good afternoon, everyone. I'm happy to kick off this discussion this afternoon, talking about one of our priority bills at Western Center, and that is AB 2319. AB 2319 was introduced by Assembly Member Lori Wilson and also Assembly Member Dr. Akia Weber. Also note that it's co-authored by all members of the California Legislative Black Caucus. In addition to Western Center being a co-sponsor of this bill, it's co-sponsored by the Attorney General, Rob Bonta, Black Women for Wellness Action Project, Reproductive Freedom for All California, and the California Nurse Midwives Association. I thought it was important just to mention everyone involved because, as you can see, there's a wide coalition of support for this bill. So what does AB 2319 do? It aims to reduce the alarming and disproportionate maternal mortality rate of Black women and other pregnant persons of color by ensuring successful implementation of the California Dignity in Pregnancy and Childbirth Act of 2019. That was legislation that was previously authored by former Senator Holly Mitchell, and that bill was SB 464. And just because it's a long title, we'll reference this act as either the act or SB 464 moving forward. So you all have probably heard the devastating statistics that the United States has the highest maternal mortality rate in the developed world. And in California, people of color, particularly Black women, continue to die of pregnancy-related complications at 3 to 4 times the rate of white women. Evidence suggests one key cause of this disparity is implicit bias of healthcare providers. So the act that I previously mentioned was passed by the legislature to address these disparities. And what it did was require hospitals, primary care clinics, and other facilities to conduct evidence-based implicit bias training for all healthcare professionals who provide care during the patient's pregnancy. I will note that that law was effective January 1st, 2020. So fast forward to August of 2021, the Department of Justice launched an investigation to ascertain compliance with the act. When they started the investigation, they sent out inquiries to facilities, healthcare facilities, and of 242 facilities that responded to the inquiry, 201 of those facilities had not completed or even begun training until they were contacted by the Department of Justice. So at the conclusion of the investigation, it was clear that additional steps were needed to ensure compliance with SB 464. And that's where this new bill, AB 2319, steps in to seek to provide the mechanisms to ensure compliance. Some of the provisions of AB 2319 includes there is clarity provided on which facilities are mandated to administer implicit bias training and to which employees need to be trained. There apparently was some confusion from some of the healthcare facilities, whether they were required and who needed to be trained. The bill also establishes firm deadlines on when the training must be completed. The bill establishes administrative penalties for non-compliant facilities. and also requires compliance data to be posted online so that the public is aware of which facilities have provided implicit bias training and which have not. There are other provisions in the bill to strengthen the requirements of SB 464, and we look forward to working with the legislature and co-sponsors on successful passage of this important measure. I want to thank you for allowing me to share with you this afternoon, and I'd be happy to discuss in more detail offline or to answer questions at the appropriate time. So that concludes my part on this, and I will now turn it over to Whitney.
Thanks, Sandra. Hi, everyone. My name is Whitney Francis, and I'm excited to share more about our bill, AB 2956, Protecting Medi-Cal Coverage for Californians Act. The bill was recently introduced by Assemblymember Tasha Burner, and we are excited to be co-sponsoring or to have additional co-sponsors of the Children's Partnership and the Latino Coalition for a Healthy California. And to give a little bit of background before I jump into exactly what the bill will do, since March 2020, with the start of the pandemic, Medi-Cal paused all renewals so that people would be able to keep their coverage during a major public health crisis. And fast forwarding to April of 2023, with the public health emergency lifted, Medi-Cal renewals have begun in that process of redetermining Medi-Cal eligibility for all of those members who for the past 2 years did not have to go through that process is called the unwinding period, and it's a 14-month period, so it is going to go through this April or May. But through that time, we've seen an overwhelming amount of people who are disenrolled from Medi-Cal are being disenrolled for procedural reasons, or otherwise known as paperwork reasons, meaning they're being disenrolled from Medi-Cal by no fault of their own. At the peak of the Medi-Cal disenrollment back in November 2023, we were seeing that rate of procedural disenrollments at 92%, which is very high. The national average at that time was at 71%, placing California as the 4th worst state in the nation in terms of procedural termination rates. And procedural terminations can result in people cycling on and off of the eligible people cycling on and off of the program known as churning, where people are experiencing gaps in their healthcare coverage, which can lead to things like postponing their healthcare coverage and not filling prescriptions, or even being hit with large sums of medical debt, not knowing, like going to the doctors and not knowing that their coverage had lapsed. So this is a very big issue and hurdle for a lot of low-income Californians. During this time, California, or the federal government, issued federal flexibilities that are called unwinding flexibilities to help sort of facilitate and ease some of the burdens of this renewal process on folks who are enrolled in Medi-Cal, and also on the administrative staff who have to process all of these renewals. And some of these, DHCS put these flexibilities into effect starting December 2023, and we're now seeing some of that data come in, and we've seen an increase in the rate of automatic enrollments, meaning that people didn't have to do submit any renewal paperwork or information to get their Medi-Cal renewed, which is a huge win. And so this bill would seek to make those unwinding flexibilities permanent. They're currently scheduled to end at the end of this year, December 2024. And so we want to make sure that this bill would make sure that those flexibilities that have that we've seen have improved the process for folks who are renewing their Medi-Cal and for the employees at the county level who are processing those things. That we can make those systemic changes permanent to improve the renewal process for Californians. And in addition, the bill would also adopt a 12-month continuous eligibility, meaning that once people are enrolled in Medi-Cal, they would keep their coverage for a full 12 months, regardless to changes of income. As the way that the system currently works, people renew their Medi-Cal or have to go through the renewal process once a year, every 12 months. But in between those times, if people have a change in circumstance, such as a change in their income, then they have to submit that information to the department, and then they will go through a redetermination process, often resulting in people getting kicked off of Medi-Cal. Even just being $1 over the income threshold can kick people off. So this would help people to keep their coverage and reduce the barriers associated with Medi-Cal renewals and protect our most vulnerable Californians. So excited to be working on this bill. And with that, I will kick things off to Tina.
Hi, good afternoon. My name is Tina Rosales Torres. I use she, her pronouns. I'm a housing attorney and policy advocate on the housing team. So a fundamental tenet of Western Center is that we believe housing is a human right, and that includes stability for all Californians, but particularly for low-income Californians and Californians of color. This includes the right to safe, stable, affordable housing in an area of their choosing. But in order to effectuate that goal, I'm going to highlight two key bills that we are working on this year. The first one is AB 653 by Assemblymember Gomez-Reyes, and the second one is AB 846 by Assemblymember Bonta. So turning to AB 653, you all may have heard of this before. This is a 2-year bill that we have already been working on. And essentially what this bill does, it will try to improve what's called the utilization of the section of the housing voucher program. For those of you who don't know, this is the federal government's most effective means of assisting very low income Californians, families in general, in the private housing market. So vouchers have been tested, and they are a proven way to reduce houselessness and housing instability, while also providing steady revenue to market rate landlords because they do subsidize the rent. Unfortunately, we've seen some problems with the program, especially with the California Public Housing Authority, or PHAs, who administer the program. And what we're seeing is that the program administration are leaving tens and thousands of vouchers unused. What that means is we have tens and thousands of families who are unable to find housing in an already really tough housing market and in multiple housing crises. So what we're trying to do is combat this problem by creating a program that will provide housing assistance. It will also include landlord incentives. So we are creating a relationship where people can utilize their vouchers, and the landlords also get benefits other than the rent being paid, which they are also getting. But it's also going to include data collection, because we need to know what's actually happening with these vouchers, how to make sure that they are utilized properly, and what we can do going forward to ensure that we can continue utilizing the vouchers. And one of the ways that we're doing that is requiring California's HCD, which is the Housing and Community Development Department, to analyze and improve their voucher policies. We are in the second house, and we don't anticipate a hearing probably until sometime in June, That doesn't mean our work is over just yet. We are waiting for key information from HUD, and we are engaging with the budget process to ensure that this bill gets over the finish line. So for the second bill, it's AB 846 by Assemblymember Bonta. Now, the largest source of new affordable housing in the United States is the Low-Income Housing Tax Credit Program, or LIHTC. Now, unlike other federal programs or the voucher, which I just described, this doesn't provide housing subsidies, but it provides a tax incentive to encourage developers to create affordable housing. And also, this program is a little bit different in that it's administered by the IRS and not the HCD. So that's kind of unique to the program. It's really popular. It gets bipartisan support every time. And Biden just announced yesterday that funding LIHTC is going to be a priority for this administration. But 80% of the people who receive the tax breaks are for-profit developers. So they're the ones that benefit from these incentives. And that the way the program works is it's supposed to provide affordable rent to Californians. But in reality, it's more like providing below market rate rent. So it's still lower than what current market rate is, but it can still be really unaffordable for people. The way that the program works is it tries to set rental limitations, so how much rent can be charged based on the area median income, which is the AMI. But because the rent is based on AMI and not an individual's income, tenants have been known to pay between 60 and 80% of their income in rent. So in California alone, 40% of LIHTC residents are considered housing burden, which they're paying more than 1/3 of their income on the rent. This doesn't include things like pet fees, parking fees, and other types of fees associated with the program. And LIHTC doesn't, the state rent stabilization ordinance, which is a rent cap of 5% plus CPI no more than 10%, which Western Center was critical in passing, they exempt LIHTC programs. So essentially a tenant can be charged 15, 20, 30%, as we've seen in areas like Marin and San Diego and San Jose, and when I was litigating back in Los Angeles. So what we're trying to do is we're saying, hey, all we need is for the tenants in LIHTC properties to be also protected by the statewide rent cap, which will prevent their rent from being increased 5% plus CPI no more than 10% and keep people stably housed. I want to take a moment to just say thank you to our fabulous development team, as well as the Sacramento advocates and all of y'all for joining on this journey with us as we go through the 2024 legislative season. And with that, I will pass it over to my good colleague and friend, Linda.
Thanks, Tina, and hello again. Here to share our medical debt consumer protection bill, Assembly Bill 2297, authored by Assemblymember Friedman and co-sponsored with Betsedic. The bill would eliminate practices of collecting medical debt that have disproportionately harmed communities of color and update eligibility criteria for hospital financial assistance programs to better serve low and moderate income patients. And so we know that medical debt is a significant driver of bankruptcy, poverty, and racial inequities. The bill would modernize the Hospital Fair Pricing Act, which was implemented over a decade ago, nearly two, in 2007. To establish minimum guidelines that hospitals must follow when offering financial assistance, as well as when collecting unpaid accounts. And despite some of these protections, patients are still getting hit hard with large hospital bills. Some hospitals impose arbitrary deadlines and disqualify eligible patients from financial assistance. And so this bill would clarify that hospitals must review financial assistance eligibility at any time and expressly prohibits application deadlines for financial assistance. The bill would also address historic inequities in wealth accumulation. We know that home ownership is the greatest asset for many Californians and often the way that families build generational wealth. However, debt collectors are allowed to place liens on patients' homes to collect unpaid hospital bills. In fact, in a review that we've done of just 2 debt collectors in Los Angeles County, we found that these 2 debt collectors that work on behalf of healthcare providers have over 140 property liens, mainly on primary residences, that were placed in the last year alone. And so this bill would completely prohibit home liens in the collection of unpaid hospital bills for financially qualified patients. The bill also would protect Californians' savings from being depleted when seeking hospital care by removing asset consideration in financial assistance determination. It aligns with our current Medi-Cal eligibility rules, which the Western Center was successful in leading the advocacy around to eliminate the asset test on the Medi-Cal side. It also simplifies the application process and reduces patient confusion. The bill makes other technical changes that benefit patients, but in the interest of time, I'm going to pass it to our newest advocate, Becca Gonzalez, to share some of our public benefits work.
Thank you, Linda. As Linda said, my name is Becca Gonzalez, and I'm the newest advocate at the Western Center, and I'm on the Public Benefits and Access to Justice team. My pronouns are she, her. And so I'm here to talk about our CalWORKs budget work and work to reform CalWORKs. First, I'll let you know where we are in the budget process. So the governor released his proposed budget on January 10th. And the biggest thing to remember about the budget on January 10th is it's only a proposal. It's our starting point. And so he had his opening volley. Budget subcommittees have started their hearings and they're starting to break down the budget into its component parts and get testimony. The May revision of the budget comes out in mid-May. And what this does is the state looks at April tax receipts so we have a better idea of how much money we actually have. And then the budget, there must be a budget deal. The legislature must pass the budget by June 15th. That's a constitutional deadline. And then the governor must sign the budget by the start of the fiscal year on July 1st. As you probably have all heard, we have a huge budget deficit. In January, it was projected to be $38 billion by the Department of Finance, and some estimates were really much higher. We will get a better picture of what the actual deficit is once April tax receipts have come in. So on to CalWORKs. As many of you know, CalWORKs is California's anti-poverty program that provides life-saving cash aid and supportive services. CalWORKs serves 750,000 children living in 360,000 families. And these families are overwhelmingly led by women, 90%, with a disproportionate share being Latinx at 60% and Black at 17%. These families face huge barriers, such as racial and ethnic discrimination and systemic barriers to economic prosperity. And although the budget proposal does not cut CalWORKs grants, the proposal cuts over $1 billion in programs that serve low-income families by emptying the safety net reserve, which I'll discuss a bit later, and permanently cutting $300 million from the program. This includes the elimination of the Family Stabilization Program, which supports CalWORKs families to ensure housing, mental health, safety, and family stability. And we have heard from many CalWORKs recipients on how these services have kept them housed, allowed them to pursue a higher education, and enabled them to stabilize their families. There's also been reductions to the employment services intensive case management program to provide one-on-one assistance to CalWORKs participants requiring exceptional support to overcome barriers to employment, and also the elimination of the subsidized employment program, which provides additional job opportunities to participants to provide job experience and a path to unsubsidized employment. Many of these cuts are retroactive to the current year's funding, which would result in abrupt, painful transitions for administrators, the program workforce, and further destabilize families. In addition, the budget transfers $3.2 billion out of $9.8 billion budgeted for CalWORKs to programs outside of CalWORKs as allowable under federal law to allow the state to balance their budget. Back to the safety net reserve, which I referenced earlier, the governor's budget proposes to completely eliminate the safety net reserve, which is a cut of $900 million. This reserve was created to help cover the costs of Medi-Cal and CalWORKs caseloads in the event of an economic downturn. Proposing to completely eliminate this reserve while still proposing major cuts is a double cut to the program. And what's important to remember is compared to other items in the budget, the CalWORKs program has been singled out for major cuts this year. We are currently working with the legislature and the administration to fight these cuts, and we are partnering with our coalition partners to raise our voices in this space. Secondly, I'm going to talk about reimagining CalWORKs. The governor's budget does signal the administration's intent to participate in a federal pilot program, which provides an opportunity to reimagine CalWORKs. CalWORKs is a deeply flawed program that is the product of federal law that is premised on racist and sexist stereotypes of poor people, especially Black women, as unable to manage their lives and who need government oversight to access cash assistance. We recommend CalWORKs be dismantled and replaced with a far less intrusive program. The work requirements, time limits, constant surveillance, financial sanctions for families to comply, rigid reporting, and aggressive fraud investigations are not only cruel, but also cause significant financial harm and toxic stress. Participating in the federal pilot will allow California to truly reimagine CalWORKs to be a family-centered program and allow participants to thrive. We will continue to fight these cuts and to improve the program for the future. Thank you, and I want to pass this on to Chris if he is here at this moment, if not Brandon. Thank you.
Thank you, Becca. My name is Christopher Sanchez. I'm a policy consultant with the Western Center on Law and Poverty, working on issues related to public benefits. And the bill that I want to highlight for you is something that we've kind of been telling you for a while on an issue related to access to mail. So as many of you know, last year, the Western Center on Law and Poverty had published a report, Return to Sender, that kind of outlined the issues that are happening with individuals who are unhoused relating to their inability to access mail. Important documents such as their driver's license, CalFresh cards, DBT cards, the same cards for CalWORKs recipients, and so forth. So as a result, this is our second year to introduce legislation. This year we have reintroduced SB 1107 by Senator Marilena Durazo from Los Angeles to continue the conversations that we've been having with counties on how to administer an option for unhoused individuals to obtain these important documents that are really life-saving programs. As you'll see in the report that has just been provided in the chat, you'll see that not having an address has hindered many folks who are eligible for services or who have successfully signed up for services being able to actually obtain those services or the aid that is supposed to be provided to them. So this bill is going to be heard on April 1st in the Senate Human Services hearing, and we have already begun conversations with various stakeholders on this issue. But fortunately, we're able to say that this year, a lot of stakeholders really understand the issue and are coming to provide technical assistance to us and have guided us through this process to say that they want to work with us on this issue. Of course, we're going to face somewhat of an uphill battle when it comes to implementation, just for issues related to security of mail that are beyond the scope of this bill. But we'll continue to have those important dialogues with all stakeholders that need to be present. That's the essence of our bill, and I'll pass it on to the next speaker.
Thank you, Chris. Again, Brandon Green, Policy Director. The bill I want to highlight is AB 1815, which is the Crown Act 2.0. This bill builds on SB 188, which was passed in 2019. California was one of numerous states that passed the Crown Act. The purpose of the Crown Act was to extend protection for traditional and protective African-American hairstyles that may or may not conform to Eurocentric standards. This is important, particularly in this moment, as numerous things around diversity, equity, inclusion are under attack and under threat. It's also important because Western Center supports the Reparations Task Force and its recommendations. Reparations is one of the priority areas for Western Center. Western Center is part of the California Organizations for Reparations Coalition as well. And this bill is one of the priority bills for the California Black Caucus in their legislative package that details reparations. The Crown Act is also discussed in the Reparations Task Force report in Chapter 26, which is policies addressing control over creative, cultural, and intellectual life. If you have not had the chance to either read or review the report in its entirety, we hope that you'll take the time to, and if you don't have the time to read the entire report, at least look over the recommendations, as those recommendations will likely fuel a lot of work in the state. Specifically, AB 1815 looks to expand the protection of the Crown Act to amateur sports, that is sports outside of the scholastic context. To do this, it also means the California Education Code definition of race for purposes of extending the anti-discrimination provisions of the Education Code and the Fair Employment and Housing Act to include traits historically associated with race, but not limited to hair texture and protective hairstyles. This is also timely because in Texas, the Crown Act was passed there as well. But in the news cycle, we have seen a young man who has been suspended and out of school for many, many months, who has hair like mine. And that was challenged in court related to whether or not the Crown Act protected the length of that young man's hair. So that is an ongoing conversation that highlights that hair-based discrimination is real, and that things that are discussed in the Reparations Task Force are both real and timely. And we are happy that we've been able to engage in those conversations as a co-sponsor on that bill and be engaged with other organizations across the state who are working towards the recommendations highlighted in the Reparations Task Force report and their implementation. And so with that, I will stop there. That will culminate the highlighting of some of the bills that we are working on, and we will now take time for questions. And if you have any questions, you can place them in the chat. My colleague Heather has been monitoring the chat for questions and can help us highlight them as they come in.
Thank you, Brandon. We also invite anybody just to come off of mute. This is an opportunity to engage with our advocates and share your feedback, ask any questions. I guess I'll start with a question that I have for Becca. You mentioned funds that are being cut out of the CalWORKs budget and moving out to other programs. What are those other programs? Yeah.
So this is something typically the state has done for years and years because it is allowed under federal law. I do believe that some of those funds go to financial aid programs. But the point, and which, you know, there are other good worthy programs in the budget, but this is money that is supposed to be for this program. But like I said, it's allowed by federal law, so it has been happening.
And as folks put together their questions, I'd like to pass it back to my colleague Brandon to provide us a little more of a context about the political climate in which we're bringing forward this legislative and budget advocacy agenda that's pretty pretty critical to understanding how we're approaching the state this year and how all of you can be involved in supporting the work that we're doing.
Sure. So a couple of things are happening politically. We are in the second year of a legislative cycle. We're also in a sort of budget deficit time that is set to be likely to extend beyond just this year, which puts some of the critical programs that you all heard about today in jeopardy. It's often the case, rather, when there are budget cuts, that other aspects of the work that we engage in around fines and fees and other sort of debt is looked towards for generating revenue. So we both have to be in the position of being defensive in protecting the critical programs and the funding needed to sustain them, while also being offensive. And that's in part because of the social political climate that is happening around attacks on diversity, equity, inclusion, and other sort of race-based remedies. This is important because Western Center not only focuses on economic justice, but focuses on racial justice and the intersections between the two. And since the affirmative action case from the Supreme Court, we've seen various attacks across numerous spaces. So there is litigation around venture capital funding. There has been litigation around the existence of the Minority Business Bureau in the federal government. There has been sort of pulling back away from the promises that came after the murder of George Floyd, the sort of racial reckoning that was not to be. And all of these things have an impact, particularly in the programs that we are talking about and the things that we are working on, because most of the things that we are engaged in have disproportionate impact. So houselessness is, for example, disproportionately impacts Black Californians and other Californians of color, et cetera. And so the sort of uncertainty around the legal challenges that are being brought creates this sort of fog in aura of a chilling effect that we have to fight through, and that is coupled with the sort of financial precarity. And so this is a very important time in California. It's a time where we need everyone to be bold. That is advocates, that is community members, that is funders, to be bold in this moment, continuing to fund things around equity, because we know the people closest to the problems are those closer to the solutions, and we can't actually solve the problems unless we are doing so in targeted ways. And so this work, while always important, is taking on even more important in this particular moment. Even as California just had the reparations task force, there's all the recommendations in the report. California has a racial equity commission that just had its first meeting. We're also part of a coalition that is seeking to influence the work of that commission as well. But all of these things were done from a place of actually getting California to a place where there is equity for all, and all those things are at risk. And the politics makes it challenging to push the things through that we are trying to push through. And so we need the support of the entirety of the community in terms of letters of support, if you're a community member or advocate, and in terms of the funding and resources for us, our community partners, et cetera, to continue the work that we're doing.
Thank you. And Brandon, I think you just answered this question about the coalitions that we are part of supporting reparations. If you could talk a little bit about who those bodies are and our role in those spaces.
Sure. So one of the coalitions that we're part of is called the California Organizations for Reparations, the CORE coalition. It includes a lot of people, including the Alliance of Boys and Men of Color, the ACLU of Northern California, the Black Youth Leadership Project, Boys and Girls Clubs of America, the California Black Health Network, and a great deal of others. We are in the policy subgroup of that coalition, but there's various other subgroups as well. That coalition broadly is in support of SB 490, which is the bill from Assemblymember Bradford around the establishment of the Freedmen Affairs Agency, which that coalition believes is imperative for the continued work around reparations, so that there is an embedded agency in the government to continue the work of implementation around reparations, which we believe will be a decade or longer to achieve a lot of the things listed in the report. And that the members of that coalition, have independence in terms of deciding which other aspects of the reparations task force things to report. So one of the articles says that the California Black Caucus members put forth their reparations legislation, their bills this year. Some of the coalition members may support some of those. Some of those coalition members may support all of those. Some of the coalitions might not support any of them because none of the bills this year actually contemplate monetary compensation, which is very important in the reparations conversation. But it is great that we've been invited into that space and that we're able to build with other like-minded organizations across the state from LA to Sacramento.
Thank you, Brandon. We'll give it a minute or so for any folks who want to pop off of mute to ask their questions or drop them in the chat. Also, if our advocates have questions for each other, feel free to ask. We'll leave it open for a little bit longer. Hearing none, I'm going to pass it back to Brandon and Linda to close us out. We've dropped many links to different reports, fact sheets on our bills, current articles about the issues we've presented on today. So please feel free to click on those, save those in your tabs, as well as we'll be posting the recording of this presentation on our website under events, Meet the Advocates. We thank you all for coming out, and I'll pass back to Brandon and Linda to close us.
Thanks, Heather. And just on behalf of Brandon and myself, we're excited about this 2024 legislative package, and looking and as hearings begin, we'll be sure to follow us on our different feeds to stay abreast of all the updates as we move along through what will be a very busy legislative season. So thank you again for joining.
Thank you all again for taking the time this afternoon in the middle of the day to join us. This is just a slice of some of the bills that we are working on this year. So as Heather and Linda mentioned, please feel free to follow us in the various social media channels and keep updated on our website for the other bills that we will be supporting. As I mentioned, it's a sort of strange and precarious time and year, but the work is still being done, and so we thank you for your support.
Thank you all. Have a wonderful day.
Thank you.